Welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the first exercise in the hip replacement exercise program. And this exercise is called hip abduction in standing. So you're going to need a chair for this exercise, or you can also do this at your kitchen counter or kitchen table or even by your bed. I want you to make sure you do this next to a surface so that you have something to hold on to. If you don't need to hold on to it, you don't have to, but at least you have that if you need it. And remember, these exercises are exercises that you're going to start performing once you have already been through at least a few weeks of the home physical therapy. So like I said in the first video, some doctors don't recommend further therapy beyond that, and some patients just choose not to do further therapy beyond that. So because I run into that a lot in my own community, that's why I decided to put this exercise program up on the website. So, all right, so hip abduction is the name of this exercise. Again, this is the first exercise in this program. And hip abduction just means bringing your leg out away from your body. That's all it is. So abduction is moving the leg away from your body, or away from what we call the midline. And that's what this one looks like. Now, for these next few exercises, you're going to raise your operated leg, right? I don't like to always call that the bad leg, because now that it's been fixed and you have a new hip, it should actually be, and eventually be, your good leg. So you're going to raise the operated leg up like that. Now, for this one, you're also going to stand on the operated leg if you can tolerate it at this point. For some of you, at about that 4-week mark, you'll be able to tolerate standing on that leg while raising your non-operated leg. For some of you, you won't be able to. If that's the case, then you need to wait another week or two. Just continue with the exercises that you were given by a physical therapist. Continue with those until you can tolerate these exercises without increasing your hip, or without increasing or giving yourself some hip pain. All right, so like I said, the next part is standing on your operated leg and moving the other leg. So I'm going to take my chair, just move that over here. And again, you can use that chair to hold on to. If you're standing on that operated leg, most likely, most of you are going to need some support from a counter or a chair or a kitchen table. And that's what that looks like. All right, so this leg should feel pretty easy to move. This is my non-operated leg. It's going to feel pretty easy to move. However, putting weight on my operated leg is what's going to be uncomfortable at this point. And if it's uncomfortable, that's okay. If you feel like that leg just won't support you, or it gives you some sharp pain, then it's too soon. You're not ready for this particular exercise. All right, so how many of these are you going to do? I would like you to do 2 sets of 15 repetitions on each leg. So a total of 4 sets. I want you to do 2 sets on your operated leg, then you're going to stand on your operated leg and do 2 sets on the non-operated leg. All right, let's see. If you could do this exercise program once or twice a day, that would be great. It had a minimum of once, but if you can get these in a second time during the day and you feel like these are helping you out, that you feel like you're getting stronger, then definitely get that in a second time during the day.